infection post-amputation, presented by
Gina Carrasco,
Nicole Don Diego,
Jillian Espinoza.
Joanna Magno.
Stephanie Seattle.
Meet our patient, Carlos.
He is a 70-year-old male of Hispanic descent.
he's married to the love of his life and has strong Catholic roots.
He admits to smoking at least a half a pack of cigarettes a day and does not plan to stop anytime soon. He denies drinking alcohol or drugs. To help him get around, he uses a walker. His past medical history is
Type 2 diabetes
Hyperlipidemia, hypertension.
peripheral vascular disease
and a history of CVA in 2009. Carlos presented to the ER. He is a 70-year-old Hispanic male, married and Catholic, no known food or drug allergies, and a full code status. He had a chief complaint of severe pain on the left foot with Enterobacter infection. His past medical history includes diabetes mellitus type 2, hypertension, hyperlipidemia, PVD, a history of CVA in 2009, and he is a smoker.
His labs were white blood cells increase, which leads to leukocytosis due to the infection. The hemoglobin was low. Hematocrit was low, which is associated with anemia. The platelets were increased, which increases the risk of a DVT. The glucose was high too, which is related to the patient's diabetes. And the electrolytes were normal. His vital signs were temperature was within normal range, but we will continue to monitor due to the infection. The pulse was normal, respiratory rate was normal, the blood pressure was a little elevated, but the patient has chronic hypertension, and it also may be related to the pain. The O2 stat was 98% in room air, and the pain, Carlos had mild pain in his left foot, and it irradiates up to the knee.
IV therapy includes 22 gauge on his right wrist inserted on January 1st, 2016, INOS intake of 1765, output of 2000, with a balance of negative 235. His diet includes diabetic diet to help with his glucose control.
Diagnostic procedures were done for Carlos. Left foot x-ray, which confirmed no definite osteomyelitis. Left lower extremity venous Doppler, which showed no evidence of DVT. And left lower extremity arterial Dopplers, which showed significant left lower extremity disease with occlusion of the mild and distal femoral artery, popliteal artery, and calf arteries. His medication consists of Lantus, Novolog, and Humalog for his diabetes, atenolol and HCTZ for his hypertension, and Plavix for his heart. Pain medication considered of gabapentin, baclofen, naproxen, and NACO.
Our 5 nursing priorities are infection control, management of PVD, management of diabetes mellitus type 2, management of pain, and impaired tissue integrity. Patient education for Carlos is fall prevention, diabetes education, and wound care education. Our long-term needs are nursing home referral to continue improving, continue with PT and OT, and follow-up appointments with primary care doctor.
Wound stages. Stage 1, inflammation phase. Injury occurs, blood vessels constrict, platelets start to form. Later, blood vessels dilate to let nutrients, WBCs, antibodies, and enzymes enter the wound.
Proliferation, healthy granulation tissue, which leads to nutrients and oxygen, extracellular matrix and collagen. Reddish or pinkish means it's healthy, and then the formation of fibroblasts.
Number 3, maturation, the remodeling stage which strengthens fibroblasts. Unfortunately, Carlos presented in the ED due to being non-compliant with discharge instructions after post-amputation of his left toes. So he's stuck at this stage, which didn't heal properly, and now he has pus formation.
These are the top 5 problems that Carlos may encounter.
Psychological and physiological needs, which can be helped with psych consult and support groups to deal with possible body image, self-esteem, and depression issues.
To alleviate his pain, he's currently taking pain meds such as Norco and gabapentin.
To prevent complications, he can have proper wound care of his left foot, diabetes control, so making sure his blood sugar is in parameters, and smoking cessation.
To promote functional mobility and ability, he can seek consult with a physical therapist and an occupational therapist.
And Carlos should complete his antibiotic therapy, which is Losartan.
Medical management for Carlos and his left foot consists of
Keep Carlos hydrated with normal saline and continue with his Rocephin for the infection.
And he should be on a diabetic diet, which consists of chicken, fish, fruits and veggies, and whole grains.
And his activity and exercise includes occupational therapists and physical therapists.
evaluation, discharge recommendations.
Referral to a nursing home for continued improvement. Continue on a diabetic diet.
Continue with his medication, Rocephin, and continue with pain medication.
Continue with wound management and diabetic control.
Continuation of occupational therapy and physical therapy.
Continue with a doctor's visit to follow up on his wound, and continue to promote smoking cessation.
The end.
The end.